Welcome to Lecto. Today we are going to discuss ringworm, or you can say dermatophytosis, or you can say tinea. So here are basically the different names of the ringworm. In this lecture we will discuss the different aspects of the ringworm. Ringworm is basically a fungal infection that is specifically related to the skin. That is why it is called cutaneous mycosis, means skin fungal infections. No doubt it will affect the other structures as well, but on the behalf of the skin, these actually fall in the category of the cutaneous mycosis. So dermatophytosis, tinea, or you can say ringworm. Okay, what structures will be affected by the ringworm? Okay, or you can say dermatophytes, and that will be the keratinized structure. Keratinized structure will be affected by the dermatophytes fungus. Okay, so in the keratinized structure you will see three most important: skin. First one will be the skin, second one will be the nail, and the third one will be the hair. So here are basically the three superficial structures that are actually affected by the dermatophytes. Dermatophytes is basically a fungus, but the infection and the disease will be the dermatophytosis, tinea, or you can say ringworm. Okay, next most important thing, as we have discussed, the fungus will be the dermatophytes. Here is the fungus. Okay, and that fungus will be present in the mold form. In the mold form. Okay, and as we know that the mold form will exist in the cold temperature, means below the body temperature. Body temperature will be 37. Okay, now the mold will exist below the 37. Okay, and as we know that the mold actually present in the form of hyphae. Okay, so dermatophytes actually exist in the mold or hyphae form. Okay, if we discuss the genera, basically three most important genera that actually cause the ringworm. So you will remember these genera by the mnemonic, that will be the MET. Okay, first one is the microsporum. Okay, first genera will be the microsporum. This is the first genre. Second will be the epidermophyton. Epidermophyton. This is the second genus. And last will be the trichophyton. Trichophyton. Here are basically the three most important genera that will cause the ringworm, or you can say tinea. Okay, and if we discuss the transmission, then how this infection transmit from one person to another. Okay, so most important, the ring infection will transmit from person to person. If one person is affected by the ringworm, then it can transmit the infection to the next person. Okay, but there is an exception. Okay, this infection can also be transmitted from the animals to the person. Animals to the person, but this case will be specifically to the genus of the microsporum. Only the microsporum genus organism can be transmitted from the animals to the person. That is an exceptional case. Okay, next, if we discuss the condition, what conditions actually fungus require? So fungus require two most important conditions. First one is the humid condition, humid environment, humidity, and next will be the warm. So those parts of the body that are actually humid and the warm, then the ringworm infection will be common at that part of the body. Okay, So if you see athletes athletes foods, because in the food you will see the humid humidity due to the sweating and the warm condition. So most important, the fungus can grow on the food due to the following conditions. Or you can say that the jock itch, that will you will see the infection in the groin region, because that region actually also humid and the warm. Okay. Next, if we discuss the shape of the ringworm, that's the most important thing. Actually, we have discussed, you will see the infection in the skin. Okay, you can see the infection in the hair, or you can see the nail. So here are basically the three most important parts of the body that are affected by the dermatophytes fungus. Okay, so in the skin you will see the ring shape, inflame ring. Okay, inflamed area. Okay, and in this inflamed area you can see the papules, or you can see the vesicle, but the central area will be normal. That is the shape of the ringworm. It is not a worm, it is actually a fungal infection. Okay, so that's the most important thing. You will see the structure, that will be the inflamed surrounding boundary, and in the inflamed boundary you can see the papules and the vesicles. Okay, and the central area will be relatively normal. Okay, and you can also see the pruritic conditions, itching, lot of itchings in this structures, inflamed area. That is another important features. Okay, if we discuss the one genus of the ringworm, that will be the trichophyton. Okay, so trichophyton tonsurans, that is the fungus that cause the tinea capitis. Tinea capitis. Capitis means head infections. Okay, that is capitis mean head infection. Okay, and this is actually tinea tonsurans is most commonly in the children. Okay, fungal infection in the head region. Next is the trichophyton rubrum, that is also the tinea capitis infections. Head, you will see the fungus will be present on the head. Okay, next is the trichophyton schonleinae. Okay, that is another important fungus. They also cause the tinea capitis, but now in this case you will see the presence of the fungus on the scalp, and the scalp will form the crust like appearance, and that appearance will be called the favis. That will be the favis. Okay, fungal infection, that is due to the Schonleinae, and in that case you will see the crust like appearance on the scalp, that will be called the favis. Okay, and lot of other species of the trichophyton will cause the pustular lesions on the head, and now these pustular lesions will be called the carrion. But now in this case you will see the formation of pus as well. That is an important case, that is pustular lesions on the scalp, and that will be called the carrions. Okay, next we give the name to the infections according to the body parts. Okay, if the head is affected, first one, if the head is affected by the ringworm, then this will be called the tinea capitis. Okay, And if the foot is affected by the fungus, foot is affected by the fungus, then it will be called the tinea pedis. And if the groin area is affected by the fungus, and that will be called the tinea cruris. And if the body affected by the fungus, now that will be called the tinea corporis, because corporis means body. And if the nail is affected by the fungus, now in that case that will be the tinea unguum. That's the most important thing. And in this case, that can also be called the onycomycoses, nail fungal infections. Okay. And in this case, you will see three most important changes in the nail: broken nails, hard nail, and the nail will be, the color of the nail will be changed. So here are basically the three most important properties that is related to the tinea unguum. Okay, nail infection. So here are basically the five categories: head, foot, groin, body, and the nail. Okay. And next one is the dermatophytic reactions. This is actually a hypersensitivity reactions. Okay, when the fungus enters into the blood, this is actually the cutaneous skin infection, superficial infection. When the fungal enters into the blood, then you will see the dermatophytic reaction, that is hypersensitivity reactions. Okay, if we discuss the lab diagnosis, okay, you can see the fungus, you can see the, you can take the scrapings of the skin and the nail, and in the 10% potassium hydroxide, after adding the scrapings of the skin and the nail in the 10% potassium hydroxide, you can go towards the microscopy, and in the microscope you will see the septate hyphae, because these fungus actually exist in the hyphae form, mold form. Okay, that is the most important thing. Okay, and you can also go toward the culture, that will be sebaroids agar. In the sebaroids agar, you will see the, this fungus will start growing, and you will see the mold. In this case, you will see the mold. And last most important, you can find the or detect the fungus through the wood lamp, and this is specifically for the microsporum species. Okay, this is a lamp that is, that actually emit or radiate the UV light, and when the UV light fall on the scalp, then what will happen? Then the microsporum will start glowing or will produce the fluorescence. That's the most important thing. When the UV light fall on the scalp, and if the scalp is affected by the microsporum, then the microsporum will start producing fluorescence, and they can detect it, the microsporum species. Okay, last will be the treatment. So in the treatment, you will see the two, oral and the topicals. So in the topical, that is actually in the form of the creams, that will be the mute, and in the mute you will see the miconazole, miconazole, undecyclinic acid, you will be the undecyclinic acid. Okay, terbinafine, T for terbinafine, and T for tol naftate. Okay, here are basically the three topicals medications: miconazole, undecyclinic acid, terbinafine, and the tol naftate. And you can also go toward the oral antifungal drugs, that will be the fulvin, or you can go toward the itraconazole, and the brand name will be the sporanox. That will be itraconazole. Here are basically the oral medication. Here are basically the topical medication. And the last most important, for the nail infection, you will see the efinaconazole solutions that will apply to the nail fungal infection. So this is all about the dermatophytosis, ringworm, tinea. If you still have any question, you may ask in the comment section. Thank you so much.